All rights are reserved. Reproduction in whole or in part, without the express prior written consent of the owner, is prohibited. September 19th, 2025. The topic of discussion is going to be male herbs, support, and everything surrounding male health, male virility, muscle building, and all the things that typically would be ascribed to male physiology. Plenty of herbs out there that interact with the physiology specifically for men, and there's plenty of pathologies and underlying conditions that can affect males that will lower their testosterone or promote things that you don't want as a male, like male breasts and those kind of things, hypogonadism. So plenty of factors affecting that. But plenty of herbs that have very good documented evidence for the increase of testosterone or manufacture and support of Leydig cells in the testes to promote sperm production for fertility, as well as androgenic indications for bodybuilding, for muscle mass, that kind of thing. All of those things all promote a healthy physiology and directly oppose estrogen. We're going to get into some of what Dr. Pete always believed in terms of testosterone versus 5-DHT. But for the subject matter of the herbs, we're just going to look at the specific pharmacological effects of the herbs, and then we're going to go over something like benign prostatic hypertrophy in the context of the regular medical model, and then in the context of Dr. Pete's approach to that same condition and how they differ. If you go online and you check the information, you can find support for both. I think if you are looking at doing any kind of research on a subject and you use a search engine, you are going to get pretty much mainstream recommendations. If you look at alternative publications and alternative research journals, you will find quote-unquote impartial evidence. And even if you're looking at something like ChatGTP and you're questioning it, you will typically get mainstream physiological information. But if you challenge it, perhaps by asking the context in which the answer's been given, and how about this, for example, how about that DHT actually does not drive benign prostatic hypertrophy, but estrogen does, which is something Dr. Pete always would say. And he had a different physiological approach to the treatment of that particular condition as he did many other conditions. But I'm going to talk about the individual herbs. The pharmacology is well studied, the receptor based effects that are known physiologically are well described, and also there's plenty of empirical use, obviously predating any of what we've found out physiologically, pharmacologically, from the herb themselves. So the empirical uses basically started all of the research on how and why, and now we want to explain it in a science-based framework. Okay, so just as I came onto the show in the studio, Michael mentioned that either somebody had phoned, or maybe I don't know if it was him, but basically was just talking to describe Viagra's use. So as we're on the subject of male physiology and male virility and male health, probably most men over the age of 50, say, may have come into contact with Viagra, either its generic form or its sildenafil, which is what it's known as. So this basically is a phosphodiesterase 5 inhibitor, and it's typically given for erectile dysfunction. Essentially, it targets nitric oxide production and the nitric oxide pathway. So nitric oxide increases smooth muscle relaxation and increases the blood flow. It also, nitric oxide itself directly activates an enzyme called guanylate cyclase, which increases the production of cyclic GMP. This kind of energy currency causes smooth muscle tissue in the corpus cavernosum of the penis here to relax, allowing blood vessels to widen and fill with blood. Now, phosphodiesterase 5 breaks down cyclic GMP, so therefore more cyclic GMP is available, therefore increased vasodilation. So that's essentially how Viagra works on the nitric oxide pathway. Now, just to say here as a caveat, Dr. Pete was always opposed to nitric oxide. He did not like it. He said it was dangerous. He said there was plenty of instances, and I think in the literature there's quite a few examples of people getting heart attack and cardiovascular incidents from using Viagra. So, do you remember anything else that Dr. Pete would mention about it?
Well,
sir?
we had a client who had a heart attack after using Viagra. And, fair enough, he did have arterial occlusion, and his carotid arteries were not fully functioning. They weren't fully open. They had a lot of plaque buildup in them. But it happens. It's not a safe product. It's very inflammatory to the system. And there's definitely herbs that are much safer, like ginkgo helps to increase blood vessel dilation, ginseng, Tribulus terrestris. We've mentioned Tribulus terrestris already. Yeah. And even things like spinach can have, an effect on increasing blood flow. But I remember Dr. Pete mentioning that even some spinach, when it's grown with synthetic nitrogen fertilizer, it actually has toxic levels of nitric oxide producing chemicals in it. So it's, if you're into being natural, then you're going to be eating healthily, and you're not going to be having lots of surgeries and things that can interfere with your male fertility.
Okay, I forgot to mention at the beginning of the show, it's a call-in from 7:30 to 8 o'clock. You're invited to call in, 707-923-3911, so we'll be taking calls from 7:30 on. Okay, so last month, I think I got to yohimbe bark. So let me just quickly cover yohimbe again before we get on to the others. And then, like I said, hopefully we'll get through to the point where we're discussing benign prostatic hypertrophy as a typical pathology, but giving it Dr. Pete's perspective versus mainstream, and to show you how his views differed. Okay, so yohimbe bark contains a compound called yohimbine. It's actually used in the pharmaceutical industry. They produce yohimbine. So it's one of those, again, plants that have chemicals that are valuable, that have been produced from raw material, plant-based raw material, to produce a drug. And that drug, because they can't patent it because it's come from a plant, they can't really do too much with it other than offer it, and they produce analogues that are similar to it, structurally similar, that they then can patent because it hasn't come from a plant, but they've actually altered it genetically or physically or chemically. So, yohimbine. It acts on alpha-2 adrenergics, so it's an antagonist to the alpha-2 adrenergic system. It increases sympathetic nervous system activity. So this activity really works pharmacologically on the sympathetic nervous system. So this is something perhaps here then you might think about having some kind of caution for use with people that have anxiety, for example,
or high blood pressure.
Yeah, high blood pressure or tachycardia, a high heart rate, because it works, but it has an effect on the sympathetics. So somebody has anxiety or high blood pressure or tachycardia shouldn't be using it, because it's going to, by virtue of it being a sympathetic stimulant, exacerbate that. It's going to increase the heart rate, it's going to increase the blood pressure, etc.
I mean, even people who have high blood pressure should be careful using ginseng, Panax ginseng or American ginseng root for stimulation, just like they should be careful with using too much coffee on an empty stomach. So people have to be careful with herbs and foods if you do suffer from hypertension.
So these alpha-2 adrenergic antagonists can actually enhance libido and erectile function. Like I said, because it's sympathetic stimulant, it can increase noradrenaline and also stimulate the hypothalamic pituitary gonadal axis indirectly. It modulates prolactin some, so yohimbine may lower prolactin through dopaminergic and adrenergic mechanisms. There is mixed evidence to support that it does increase testosterone, but primarily supports the erectile function and libido. So that's yohimbine bark, and you'll find that as a pharmaceutical preparation, yohimbine. It's been actually characterized for quite a long time now. Okay, so I mentioned also Tribulus terrestris, and both the folia and the fruits are used. Protodiacin is one of the main compounds, traditionally used to increase libido as well as sperm count. So for infertility, it certainly works there because it indirectly supports the Leydig cell testosterone synthesis. So there's evidence to support its use pharmacologically for infertility. Some animal models have shown a reduction in prolactin. Again, this could be through a dopaminergic pathway. And it doesn't directly reduce aromatase activity, but improves the LH, the luteinizing hormone, to FSH, the follicle stimulating hormone, balance, and can help modulate the testosterone to estrogen ratio. Now, this is something that we're also going to get into and describe a little bit later on when we talk about benign prostatic hypertrophy in the context of what Dr. Pete would say is an estrogen problem, but that the mainstream medical model would say that actually DHT is not what you want, but you want testosterone. Well, he would argue strongly that testosterone is not what you want, because essentially it can aromatize to estradiol and estrogens, and so estrogen actually is the main protagonist of benign prostatic hypertrophy. But let's talk about that a little bit more detail a little bit later on. Okay, so next herbs. The Turnera diffusa then. So this is Damiana leaf. Typically it's called an aphrodisiac. Historically used to improve libido, erectile function and sexual performance. It doesn't significantly change testosterone, though, so it has a kind of different mechanism, as most of these herbs do. Some work on testosterone, some will work on dopamine, some will work on prolactin, some work on the sympathetic nervous system, etc., etc. Some work purely by vasodilation. So it has a mild anti-aromatase activity, so it mildly blocked conversion of testosterone to 5-DHT. And there's some evidence to suggest that it modulates the estrogenic pathways, possibly through its flavonoid contents like apigenin, which can have weak aromatase activity. Sorry, aromatase inhibition, the anti-aromatase. Okay, so Turnera diffusa. Don't have too much more to say about Turnera. Essentially, it's been used as an African herb, certainly been used for libido and sexual dysfunction in Africa. Okay, So primarily then for improving libido, mood, possibly decreasing prolactin some, but it's not a replacement for someone with hyperprolactinemia. Probably wouldn't be strong enough. Now, things like mucuna, which we'll get into, reduce prolactin. Mucuna works as a dopamine agonist, so increasing dopamine. Then Tonkat Ali, Eurycoma longifolia. This is basically a direct testosterone support herb. I think we got into Tonkat last month, but anyway, then Chrysin, for modulating estrogen, which is a good aromatase inhibitor, as well as diindolmethane, DIM. Both of those have a anti-aromatase action. And then obviously we've mentioned previously things like nettle root. Nettle root is a very good blocker of aromatase. And so nettle root's use for prostatic hypertrophy, also depending on what tenet you're looking at or you're understanding the physiology. And also I've had lots of success with people with benign prostatic hypertrophy using nettle root in conjunction with saw palmetto as a 5-alpha reductase inhibitor. Works very well. So some people that maybe 4 or 5 times a night they're urinating, I've had people within 6 weeks or so down to a night, once a night. So it definitely works. Certainly the argument would say that maybe DHT might be better, but one's prostatic enlargement and the other one is kind of inability to urinate, and so the smooth muscle needs to be relaxed as a kind of alpha-1 adrenergic receptor agent. But depending on the person and the results, I think that's probably the main thing to bear out any true witness of what's going on.
I also wanted to mention mushrooms, well-cooked, normal white or cremini mushrooms are also aromatase inhibitors, so they're good for men and women to try to lower that overload of estrogen.
Okay, so let's get into mucuna. Mucuna pruriens. Now, mucuna pruriens has a pretty good overlap with Parkinson's. So let's just discuss mucuna's pharmacologic activity and kind of get an understanding of how this plays into hormone synthesis and how this also plays into male health. So mucuna pruriens, that's common names of velvet bean. It's actually a tropical legume, so it's in the pea and bean family. It's widely used in Ayurvedic medicine, traditional medicine. But because it has such a rich pharmacological profile, particularly as a natural source of L-DOPA, which is a direct precursor to dopamine, it's been well explored. So the active constituents then are L-DOPA, which is levodopa, 3 to 7% in the seeds, so a pretty good yield of raw material here for the manufacture of L-DOPA, and up to 9% in some varieties. Now it contains the alkaloids mecunine, mecunandine, and mecunine N oxide. It has some small trace amounts of serotonin and tryptamines, interestingly enough, and then tannins and saponins and flavonoids. But its main component here is L-DOPA. Now, the L-DOPA crosses the blood-brain barrier and it's converted to dopamine by dopa decarboxylase, the enzyme that switches that to dopamine. Used traditionally for Parkinson's, so this is how I think most papers that were written on mucuna were looking at dopamine and looking at treatment of Parkinsonism or Parkinsonian tremors, etc. It's similar to synthetic L-DOPA, but it's got a slower release due to the accompanying plant matrix. So this is another case in point for saying don't just isolate a single active component and then say that that is the thing that's responsible for the pharmacological effect or for producing the result you want, but that there's far more evidence to support the use of a complex matrix with balancing material rather than an isolated extract. So again, I said it contains large amounts of L-DOPA. It has a neuroprotective effect, and the antioxidant properties help reduce the oxidative stress in the central nervous system, which is some part of Parkinsonism's negative effects. And it can also increase superoxide dismutase, which is another powerful antioxidant as well as catalase. So both of these two enzymes can be increased. It could be called an adaptogenic, definitely an anti-stress material in the broader context of reducing stress hormones, but this is because of its cortisol reducing activity and improving the general stress response. Used again in traditional medicine for things like fertility, libido, and mood enhancement. Now, as I said, its anti-Parkinsonian activity from the seed, again, can be as effective as synthetic L-DOPA, and obviously they produce a synthetic L-DOPA because they want to be able to maintain ownership.
Well, and also, I think with the synthetic L-DOPA, it does make you feel dopey. That's what we've witnessed with our clients. And I don't think I think there's other things in Mucuna or as a full spectrum extract of Mucuna that will prohibit that dopey feeling that you can get or that clients can get from using L-DOPA or carbidopa or levodopa.
It's well known to have fewer dyskinesias and side effects of the kind of writhing movements that some Parkinson's patients can experience, because Parkinson's patients, unfortunately, it's a diagnosis made when no other cause is really found, but a wide range of different symptoms. So some Parkinson's patients will have virtually no tremor. Some Parkinson's patients will have difficulty starting and stopping, or initiating a movement or stopping a movement. Some, like I say, will have tremor, some won't. There's a very, obviously facial expression changes, but no one patient has all of them, and everyone is quite different. So it's still being unraveled in terms of what truly is the cure for Parkinson's, because ultimately they're saying that there is essentially no cure at this point, but a mechanistic approach to it would be L-DOPA, because supposedly it's a dopamine deficiency, but it's obviously not just that. It's obviously some wider neurological inflammatory derangement that's going on, which is blocking conduction of nerve signals, because it's essentially a brain CNS, a central nervous system, brain to muscular feedback that's not happening, or an over excitation of that muscle contraction. So there's definitely some aberrant neurological deficit that's happening. It may just not be specifically down to one chemical, but a multifunctional or a multi-pronged attack of the nervous system by inflammatory products, as well as lack of those simplistic and mechanistic things like dopamine. So dopamine essentially it's pretty available orally. So bioavailability is very good orally. It crosses the blood-brain barrier via amino acid transporters, and it's excreted through the kidneys. So for Parkinson's, male infertility, stress-related disorders, for mood enhancement, for mild depression for some people, and obviously then it's an aphrodisiac traditionally used, but we understand it now pharmacologically and pharmacokinetically because they've studied it in terms of the receptors it interacts with and the downstream effects of stimulating those receptors. Okay, so I did mention Urtica dioica radix, nettle root. Again, it's a great first-class aromatase inhibitor. As far as I'm concerned, it's an excellent product. Both that used with saw palmetto pretty much sorts out most people with benign prostatic hypertrophy and nocturia. So, yeah, there's a question?
Yeah, I harvest a lot of nettle for food, the above ground parts, and I've learned that you need to stop before it flowers because there's a buildup of oxalates or something in there. Is that the same for harvesting the root, or are you using so little root?
No. So the traditional use of eating nettles, yeah, for sure, before it flowers, and not just for that, what you're saying, but because it gets way more fibrous and woody, and there's just less. You want to pick it in the spring when the thing has just started growing. It's about 18 inches tall. Cut out the first 9 or 10 inches of the nettle tops. Gather those in handfuls and then put them in a steamer basket, steam them well until they're completely wilted. They have no sting. You can put feta cheese on it, a little bit of olive oil, and drink the liquor. But the root, the autumn dark root is what you want. Most herbs, especially for biennials, you'll dig the root in the first year. Something perennial like a nettle every year, it wouldn't be a problem to dig it up, because every year the above ground aerial parts are withering and everything's returning back into the root. So sometime around October, November, you want to dig the root up and wash it, and then that would be a good plant material to dry, to use as an aromatase inhibitor to block your production perhaps of estrogen from testosterone, because that's what happens in men as they get older. But it's almost a function of aging and PUFA accumulation and just general decreased energy that males will suddenly start producing more estradiol. They convert their testosterone into estradiol because they're not muscular enough, their testosterone is not high enough. But there's no reason to do that. Men don't have to get weaker and weaker and weaker and fatter and flabbier and grow breasts and just end up being inactive. There's plenty that we can do, because we're gifted, as much as we're cursed, but we're gifted with testosterone that will increase muscle mass and help us to work, and that work stimulates muscles, and that's a very thing. Testosterone is a very thing that's going to prevent that conversion again into estradiol, because that anabolic system is working well. When it starts to fail and you have lower energy or more PUFA accumulation and the organism's declining from an energetic perspective, then that conversion to estradiol is actually much easier. It's a kind of default production, So nettle root, very good for preventing the conversion of testosterone to estradiol. And again, like I said, we get into it in a little bit here. Dr. Pete's rationale and his perspective on the use of DHT, which is not what you're going to get from a doctor. There's definitely instances where DHT would be excellent and superior to testosterone, because it doesn't aromatize. You can't convert DHT into estradiol, and actually would have some very good effects that you won't just get from testosterone. Okay, so saw palmetto, as I've mentioned here, nettle root and saw palmetto are two classics that I'll give people for prostatic hypertrophy or nocturia or those related deficiencies. So it's a 5-alpha reductase inhibitor. So this is saw palmetto, Serenoa cerulata, the fruits that contain a liposterolic extract. So it's a very oily, the fruits themselves are kind of black and oily, and you could almost squeeze some oily fraction from it. But again, because it's oily, it's pretty well soluble in alcohol, and a 70% extract is pretty classic for the production of a liposterolic extract of saw palmetto. But CO2 extract, again, is another good high-tech approach to it, because it specifically pulls out those lipid fractions. So 5-alpha reductase inhibitors, then, and here's the thing, I don't want people just say, well, 1 minute, you say DHT is better than testosterone. Let me just hear out the pharmacology of each individual herb, and then we'll look at Dr. Pete's rationale for benign prostatic hypertrophy treatment as opposed to the medical model. So it inhibits the enzyme that converts testosterone to DHT, which is 5-alpha reductase, and it reduces DHT levels in the tissues. Okay, so hear me out, because I'm saying that DHT is pretty good, but 5-alpha reductase from saw palmetto will decrease DHT. Now, so the prostate then. So if you're looking at a medical text for the treatment of benign prostatic hypertrophy, you're going to find this, unless you challenge it with, how about this, So it helps with benign prostatic hypertrophy, because though the DHT decreases with age and estradiol rises, so aromatase inhibition with testosterone-enhancing herbs are more targeted. That's the mechanism by which the medical model is going to look at BPH and want to actually block testosterone from being producing DHT, because they're saying the DHT is responsible for it. Now, it's also used for androgenic alopecia, so for hair loss. So you could say, hey, Michael, or hey, me, we must have pretty good testosterone, because the follicles, the blood supply to the follicles in our scalp are being constricted, and that's testosterone, right? Well, again, there's another argument. There's another argument for what would typically be a cure. I don't know if that's possible to say that word, but what will actually help hair follicle growth because they don't die. And this is something else that Dr. Pete would explain whenever I asked him about different clients with different issues. He's like, no, the follicles don't die, they just go into a senescence. So they're there, and if you give them the right things, they can actually begin to wake up and you can get some hair production. So obviously there's some well-documented drugs that were used to produce hair on the scalp, and Elton John was a famous example of that. So so far as the literature is concerned, they're saying that it may help conserve testosterone, right? Because they don't want it to be converted into DHT. So by blocking it, you keep your testosterone, and this may actually be useful down the road because the DHT is the thing that's going to close your follicles off, right? So it's anti-estrogenic and anti-prolactin activity too. So it may reduce estrogen receptor activity in prostate tissue and indirectly influence estrogen dominance. So again, it's 5-alpha reductase inhibitor, so it can have an effect on estrogen and also have an effect on prostatic tissue directly. So let me just say, you're listening to Ask Your Herb Doctor, 91.1 FM from now until 8 o'clock. You're invited to call in. Any questions related to this month's subject of male fertility and those herbs that support male fertility and testosterone production or muscle production or those things that are associated with being male. So 707-923-3911. Now, there's another factor in all of this, which is sex hormone binding globulin. So sex hormone binding globulin is the very thing that binds those sex hormones and makes them unavailable. All right. So if you can modulate sex hormone binding globulin and block it, you'll have again more testosterone available. So there is some evidence to suggest that Ceramera or saw palmetto does reduce sexual hormone binding globulin binding, slightly increasing free testosterone bioavailability by that mechanism. It also has some known anti-inflammatory and anti-proliferative effects. So again, it helps counter the local inflammation in hormone-sensitive tissues like the prostate and reproductive organs, and it may mitigate symptoms from estrogenic or DHT dominant states like prostate enlargement or sexual dysfunction. Now, I'm going to argue later on where Dr. Pete would say that it's not testosterone that you want, it's DHT that you want. So this is the kind of, you're hearing the converse now, because this is how the medical model will interpret this data.
Well, I think it just comes back down to what you already mentioned, Andrew, is that testosterone in unhealthy individuals gets converted to estrogen if the situation and the environment isn't right. And that estrogen is what promotes the inflammation of the prostate. When you have it converted to DHT, it can't ever go back to estrogen. It just stays as DHT. And that's the key here, is that people who use testosterone or produce testosterone, it can always get converted to estrogen. Just like if you take DHEA as a supplement, which is different from DHT. Dihydrotestosterone is the end product conversion of steroid hormones from testosterone. And that is responsible for a lot of male characteristics. But testosterone can get converted to estrogen, just like DHEA, which is dihydroepiandrosterone. That is a youth hormone, and that can get converted to estrogen too, and actually cause more problems for men than in the estrogen department than it should. A lot of men take DHEA to help increase their testosterone. Well, it might, but then that testosterone can get converted right into estrogen. And therefore, Dr. Pete recommended that men over the age of 50 can take maybe 10 milligrams of DHEA a day, but under the age of 50, only 5 milligrams. And you'll see supplements for sale that have 100 milligrams of DHEA. So it's a huge amount of an estrogen promoter. And men say, oh, well, I need that in order to get my testosterone up. Well, you have side effects, and that's why it's not always safe to just self-supplement without taking blood tests to look at your estradiol to testosterone ratio. Just like for women, we look at your estradiol to progesterone ratio on blood tests to make sure that you're not over-supplementing with an estrogen product. Yes, Michael.
And is it fair to say that exercise is kind of the first thing that someone should do to keep yourself in regulation, especially some weight-bearing exercise?
Right.
Exactly. I just got that question asked on the live stream. And muscle building exercises build testosterone in both men and women. Lifting weights, doing things that
hard, digging on your ditches on your road.
Yeah, just doing anything that's going to build muscle. And if it's going to increase your heart rate, to do that, you can do that really strong and powerfully for like 5 minutes, and then take a break and go back to lifting weights or squats or digging, and let the adrenaline calm back down, and then you go back at it again, because anything that stresses your system is going to produce adrenaline. And what does adrenaline do? It goes around and it tries to mobilize sugars, and it produces cortisol, and cortisol breaks down your bone, your brain, your heart. It eats you to keep you fed. Your body needs sugar, period. You need sugar. If you don't eat it in the form of carbohydrates, honey, sugar, fruit, your body will eat itself. And that happens through cortisol. And cortisol is a potent estrogen promoter, testosterone blocker, and also a progesterone blocker, because it promotes estrogen, and estrogen is a progesterone blocker. So cortisol is a stress hormone. It's great for when you need it, but you don't want to be running on high cortisol. That's what causes an immune suppression, and that's why they say stress causes cancer, because you're running on all these stress hormones. So cortisol is anti-testosterone. If you're running long distance, you're going to be running on more cortisol. That's not pro-testosterone. That's why long distance runners are lean and thin. They're not bulky like bodybuilders. So it has to fit with what your lifestyle and what your aim is with your hormonal profile. Your exercise program has to fit with that.
Okay, so let's just discuss this now, just in case we don't get time, because it's quite a ways on through the papers that I produced to discuss male hormones, and to get at that point, to arrive at the point of Dr. Pete's refutation of the prevailing narrative that DHT causes prostate hypertrophy. He actively advocated for DHT's protective and pro-metabolic role in the male endocrine system. So let's just quickly go through this. So the mainstream view, as I've been saying here the last 10 minutes or so, the mainstream view of benign prostatic hypertrophy treatment, and the mainstream view of the cause, is that the mainstream view says DHT is synthesized in the prostate via 5-alpha reductase, which converts testosterone. It binds strongly to androgen receptors in prostate tissue. Therefore, DHT is thought to stimulate prostate growth. Hence, 5-alpha reductase inhibitors like finasteride are used to shrink the prostate in benign prostatic hypertrophy. But Dr. Pete would counter argue that. He would say that DHT is not the cause of benign prostatic hypertrophy, but it's estrogen. And that estrogen and not DHT cause the growth of the prostate, where DHT is protective. And he argued this because estrogen promotes prostatic hyperplasia, not DHT. So that's fact number one. Estrogen promotes prostatic hyperplasia. Estrogen is a stimulator of cell division. So estrogen promotes prostatic hyperplasia, not DHT. The prostate is an estrogen-sensitive organ, and estrogen rises with age in men as metabolism slows. So as we've been saying, with decreased muscle mass, with increased PUFA and obesity, and the organism slowing down and energy getting lower and lower and lower, estrogen becomes more present, and the prostate's an estrogen-sensitive organ. And then estrogen-dominant states correlate more with prostate growth than DHT levels do. And then anti-estrogen drugs like finasteride disrupt protective DHT, which may increase estrogen dominance and long-term metabolic stress. Now, as we've said, that DHT is the end target hormone, and unlike testosterone, DHT cannot convert to estradiol. So if you are producing DHT primarily, or using DHT, which we'll get into in a bit, as andractim gel produced in Europe, it can't be converted to estradiol Now, this makes DHT a clean androgen free of estrogenic side effects, and we've mentioned those things like water retention, a gynecomastia in males, which is male breasts, elevated prolactin, and then that kind of emotional liability that you can happen with some men. So essentially, DHT is a very good alternative, but in the mainstream model, DHT is what they're saying is responsible for benign prostatic hypertrophy. So you've really got to sift through the science. And like I said, I have plenty of clients who've got benign prostatic hypertrophy that I have had really good success with using Serenoa, Serolata and Urtica radix as a fresh extract, and it does work. So it's not like the 5-alpha reductase thing doesn't have an effect, but DHT is probably more important or more potent at doing that work than blocking aromatase to stop the testosterone from being converted to estradiol and making sure that the nettle root itself, the aromatase blocking activity, doesn't allow conversion of testosterone to estradiol. Okay, we have a caller on the air. Caller, you're on the air. Where from, or what's your question?
Hey, yeah, I am in southeast Missouri, and I have a question kind of unrelated. In your description on the YouTube Live, it said it was okay for unrelated questions, if that's all right.
Go ahead, yeah.
Okay, I have a friend with ALS, and I've done quite a bit of research into exactly what's going on. And there's like snippets from Dr. Pete on different things he's heard of that have worked for different people with different levels of ALS.
Right.
But nothing, and I've read, the majority of the research that I can find on ALS. And, I've got her taking things like B1 and B3 and aspirin and things of this nature that have been shown to better the prognosis in regards to ALS, but nothing seems to work. Anyway, I'm not sure if you had anything that you could...
Yeah, as a nervous system disorder, in terms of in terms of the progression of it and the etiology of it, I'm sure Dr. Pete would probably mention things like B vitamins as being neuroprotective, but it is a pretty serious attack on the nervous system that has all its downstream effects in the inability to, conduct those downstream effects. So, yeah, you can talk about, metabolic energy. You can talk about, pregnenolone, progesterone being anti-estrogenic, given that estrogen is part and parcel of inflammation or water retention or poor nerve conduction due to that edema and water retention. You can talk about, like I said, the B vitamins. But I haven't had a patient with ALS. I mean, I've had patients with different nervous system disorders, but not this.
Maybe if I could just ask one more question on top of that. A lot of it seems to be like, because you mentioned the reason I'm thinking about it is you mentioned superoxide.
Yeah, SOD, huh?
And that's a big part of it. And copper not being able to complex with that protein, I guess. And so there's like some studies with like using different forms of copper to make it happen. But, I think maybe it comes down to a misfolding protein issue. Do you have any recommendations on bringing back the integrity of those proteins somehow? Because I've read about trehalose, in like mushrooms.
Right.
I've tried to get her a lot of well-cooked white button mushrooms to maybe help with that. I don't know if you've read anything or know anything about using trehalose.
That's for aromatase blocking activity, but I hear what you're saying about SOD as an enzyme to be a potent antioxidant, because obviously those things can interfere with protein folding and or derange it by being very reactive. So there's probably some mileage in having a good antioxidant defense, even if you're using things like resveratrol or those other well-known antioxidants. Obviously, Dr. Pete, I'm sure would talk about things like vitamin C in orange juice being useful because of its antioxidant activity, whilst there are plenty of other antioxidants that have been well characterized. Yeah, in order to give you a yes, this will work. I don't know if I can.
Okay. Yeah. No, I appreciate your time.
Caller,
Yep.
I'm just wondering, has this lady experimented with using large doses of progesterone?
I've attempted to get her to do that, and she's kind of the phase of, perimenopause, and so
Well, she needs
she's
it then.
like losing her period, and then like, as I was getting her to take progesterone, it was coming back, obviously, and so because of everything she was going through, it was like, I can't take one more thing on top of everything. And so
Right.
I don't know what she's doing with progesterone, but I have attempted to, I got her like the Progesti and all that. But
Yeah, because that's a potent anti-estrogen, but also I've seen remarkable benefit in being anti-inflammatory. And since ALS is such an inflammatory condition, it's like taking a steroid, but it's not suppressing your immune system and promoting estrogen. It's actually blocking it.
yeah, exactly.
So if
Yeah.
you can, and
Yeah, no, I
topically, she can
appreciate
use
that.
it topically or she can use it orally, but just try to remind her to use it with food, with meals, and maybe like large doses, like 1/8 of a teaspoon 3 times a day, which will give her, like 150 milligrams a day.
Dr. Pete would definitely encourage her to take her metabolic rate by her temperature and pulses too, because obviously that rationale for metabolic energy in the form of thyroid could be important.
Yeah, have you had her thyroid checked to make sure her metabolism is working and she's excreting estrogen and all the other
Right.
toxins that build up?
Yeah, we've done a lot of that stuff. So, yeah. Okay.
All right. Well,
Well,
I'm
I
sorry I can't
appreciate
give you
you guys.
anything concrete.
Yeah, no, thank you very much. Yeah, I was hoping maybe you'd had some clients that had experienced that, but all right. God bless you guys. I appreciate you all.
Thank you for your call.
Okay, we've got 2 more callers, so let's get this next caller. You're on the air. Where you from? What's your question?
I'm in Arcata. My question has to do with BPH, and I've been dealing with it for 20 plus years. I've been on far too many 5-alpha reductase pills of various forms. I have finally, after many, many years of it, a prostate cancer diagnosis that no longer is considered to have ever been prostate cancer. So I'm not looking forward. I avoided the aggressive treatment that they very much wanted me to do
Right.
20-some years ago. And I have finally almost convinced myself to do either aqua or steam ablation relative to an extremely large prostate and lots of urinary issues that run my life. I'm wondering about your opinion of such procedures, and I do the nettle root. I don't really know how much I should be doing. Maybe I should be doing a lot more than I've been doing.
Well,
What can you tell me?
Yeah, well, okay, so the other thing, like I'm saying, that the whole DHT is being very, very useful for benign prostatic hypertrophy. It's probably not something you've ever tried or ever had as a prescription, right?
Oh, they've done exactly the opposite.
Exactly,
They've
yeah,
done
because they're going to
everything
use...
they can
they
keep it away. And every time I ask about
yeah,
its being of value, I've been told, no, you've got to stay
they're
away
going to
from
give
that.
you finasteride, another 5-alpha the reductase block.
I'm on dutasteride, and I'm on. I've lost
So
Flomax as well as.
This is what I was saying about Dr. Pete's perspective. He would not look at those things like 5-alpha reductase inhibitors as useful. He would say that DHT is the thing you want. Estrogen is the thing that's driving your prostatic hypertrophy.
Right.
And if you block that, so you're going to use aromatase inhibitors too, so that you don't convert exogenous or endogenous estrogen that you have in your circulation, not necessarily derived from the prostate specifically, but things that are in your body, in your cells, or other inflammatory processes that are stimulating estrogen production, because most cells have the ability to secrete estrogen in response to inflammation. So you'd want an aromatase inhibitor as well as 5-DHT, and that 5-DHT specifically then would be useful for shrinking prostate enlargement, and that's that would be the rationale. So you're saying that you have had a diagnosis of prostate cancer. Is that what you're saying? They've had a
once upon a time, what they found was considered to be prostate cancer. They no longer consider that to have been prostate cancer.
Right.
And fortunately, I decided that I was going to use diet and exercise and other means, herbs, in addition to taking their advice relative to the.
Well, you know what? It's not like you can't get andractin. Andractin, it can be sourced. Belgium, I think, is one of the main places andractin is coming from. But
it's very, 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 very difficult to find DHT as a supplement for anyone because it's highly, 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 highly regulated here in the U.S. It's more regulated than opiate drugs and many, many other things. It's extremely regulated, and there's lots of conspiracy behind that.
So many of the prescriptions that, with as large a prostate as I have and as many symptoms as I have, I feel a need to do something about it.
Are you doing anything to actively block your estrogen production?
I'm convinced of doing either aquablation or steam ablation, and I'm wondering about your opinion of that. And if I do or don't do that, I hope to get off of the various prescriptions, drugs. That said, how much nettle root should I be attempting to?
Yeah. Okay. If you're taking nettle root as an extract, a 1 in 2 extract.
I'm not. I make a tea.
Say that again.
I make a tea.
Yeah, it's not going to be good enough. Okay, so you want to be using a 50% or thereabouts extract of nettle root, and for a 1 in 2 extract, you want to be taking at least 50 ml a week. So you want to be taking 1.5 ounces of that extract a week. If you're making nettle root tea, I'm not too sure how much of that activity you're going to pull out in an aqueous water-based solution over and above an ethanolic preparation of it. I mean, you can do these kind of things at your home. It's not big science. You could get vodka. You could macerate the nettle root in vodka. That would be fairly approximate. So if you took and I'll have to do this in metric forms just because it's way easier to convert it, but 500 grams of nettle root to 1 liter of vodka, that will give you a 1 in 2 extract. If you macerate that for a couple of weeks and then press that out as best you can, then of that product you're going to want to take at least 50 to 60 mil a week of that, which is 2 ounces a week. So something in the order of a teaspoon and a half to teaspoon and a half per day. It's going to give you 49 mil a week. So that would be probably where I would start. And if you want to, you can obviously purchase a nettle root extract that's been pre-made and do it that way. It's going to be more expensive, but okay. That's the first thing. And then I would ask you to make sure that whatever else you're doing, that you are blocking any conversion of testosterone to estradiol. Principally making sure that your diet is clean of PUFAs, because polyunsaturates are going to become more estrogenic. As you get older, your tissues are going to want to produce more estrogen if you don't have muscle mass. So all of these things are going to work against you in terms of promoting hypertrophy of the...
I avoid PUFAs, but I do monounsaturated olive oil.
Yeah.
Just not more than 1 tablespoon a day on the olive oil, otherwise you will increase your PUFA.
Not more than 1 teaspoon?
Tablespoon.
Did you say?
One tablespoon. One tablespoon per day.
I take less than that, but should I be taking as much as that?
No, it's just up to. It's as needed.
Good.
Thank you.
I bought into the avoid.
Actually, we got one more caller we got to get to, and a quick question is the nettle root. So roughly a gallon jar, loosely filled with fresh nettle roots, rinsed or tightly filled?
If you're going to make a fresh extract of nettle root, you want to make a 1-to-1 extract. So if you have...
tightly packed with Everclear?
Well, you know what? Everclear, yeah, perhaps. 190 proof ethanol is what you want to use for a fresh extract. It comes out at about 55% when it's pulled the water out of the root. So if you used a kilo of root to a liter of ethanol, that would be a 1-in-1 extract. You can work that out from an ounce, fluid ounce perspective to.
Or just pack a gallon jar and put Everclear in.
That's
yeah,
not.
you can do that.
Here's
Okay.
our last
All
caller.
right. Yeah, let's get this next caller. You got about 2
We got
minutes or
her.
3 minutes. Yeah, go ahead. Where are you from? What's your question?
Can you hear me?
Yes, go ahead. Where are you from? What's your question?
Lori, I'm in Berkeley. I'm
Okay.
76 and I have lots of hot flashes at night. They wake me up. And I know about what Ray Pete says about estrogen. My question is about phytoestrogens, I guess. You know, I listen to Christiane Northrup, and she has this product that is a phytoestrogen, which she says will stop the night sweats. And I'm just wondering what you guys think of that and what other suggestions you might have.
Okay, so phytoestrogens are less potent estrogens than estradiol.
Yeah.
And so that's how they can help to lower estrogen, but it's still another estrogen. And really in menopause or perimenopause with the hot flashes, you want to block the estrogen as much as possible. So a cup of raw grated carrot with vinegar and olive oil, the well-cooked mushrooms, naringinin from oranges, orange marmalade, or lots of orange juice. I'm trying to give you all the good anti-estrogen foods. And then supplementation wise is progesterone is very anti-estrogen. Glandular thyroid supplement is very anti-estrogen, helps your liver. Avoiding all PUFAs is very anti-estrogen, which are the polyunsaturated fatty acids. Avoiding excessive amounts of nuts and seeds, because those are also estrogenic. Some of them are phytoestrogens, I understand. And, that might lower some estradiol in women, but it's still another added estrogen.
Okay, we need to wrap it up. It's 3 minutes to the top of the hour, so thanks so much for calling in with questions. Thanks so much for listening. Next month, we're going to carry on where we left off with DHT. We're going to look at some of the kind of misconceptions about estrogen and its essential nature for bone density, which is not true. We are going to look at some of those quote-unquote drug treatments for hypogonadal disorders. Going to look at Vitex agnus castus. Then obviously there's some other kind of things that are going to be part and parcel of treatment, whether it's thyroid or methylene blue or vitamin B6 or and then look at Dr. Pete's rationale with this subject of benign prostatic hypertrophy and what is actually the most important thing for you. And then go cover with Ania, ashwagandha. It's got some excellent supportive details. And then Epimedium corianum, as some people would have heard this now, horny goatweed, has some very good physiological effects. It's not just a gimmicky aphrodisiac. But then again, like I said, there's plenty of different information from different people. You need to be careful where you get the information from. I think nothing is probably as supportive as finding the results that work, and I think that's the main thing. Okay, so until the third Friday of next month, my name's Andrew Murray.
My name's Sarah Johannesson Murray. Thank you so much for listening. Hope you have a great evening.
Good night.
This program is copyrighted. All rights are reserved. Reproduction in whole or in part without the express prior written consent of the owner is prohibited.